Hi. For this week's clinical conference, we have BM, who is a 9-year-old male with a past medical history of myelodysplastic syndrome, acute lymphoblastic leukemia, asthma, and eustachian tube dysfunction, and he was admitted October 20th for further treatment. He refused to talk to us during our interview, so we got all of his history from his mom and his dad. For his mother, the patient is experiencing some symptoms of anxiety, such as restlessness. She says that she has noticed that he's been having a difficult time sitting in one spot and does not want to fully get out of bed. He's also experiencing some irritability, especially toward the nursing staff, and has recently hit a nurse's hand during care. His mother also says that he is normally a very respectful, kind child. However, recently he has been more irritable. He's also not sleeping well, and his father reports that he is only sleeping about 3 hours per night. In addition, his mother also says that he has been having some difficulty with concentration in school and has been needing some increased reminders of staying on track. She also notices that he's been having some panic attacks that manifest as crying spells and have been lasting as long as 15 minutes. The only thing that helps is just leaving him alone at the time. He also endorses some symptoms of depression, such as feeling of guilt and worthlessness. His mom said that he has actually said, quote, "I'm worthless" in the past. And also she describes him as having decreased interest in activities that once were fun to him, such as riding his four-wheeler outside. However, recently he'd rather stay inside on his tablet instead of play outdoors like he did in the past. His mom described his mood as being a Sour Patch Kid. One moment he's really, really sweet, and the next moment he's very sour and mean. However, she says he has never had any feelings of suicide or wanting to die. So, for his mental status exam, his appearance, he had a large chest port coming from the right side of his chest, and then he had a hospital gown on laying in bed. His behavior was calm but very guarded and minimally engaged with us. He says he didn't want to talk to us about his feelings. His motor activity, his body posture was erect with no signs of tremors or psychomotor retardation. His speech was articulate, fluent, without any signs of slurring or speech or pressured speech. His mood, he refused to talk to us, but his mom did describe his mood as a Sour Patch Kid. His affect, he showed some signs of happiness and frustration. He actually left once during our interview, and he also was kind of frowned his brows when we tried to talk to him about his feelings. His thought content, he has no signs of delusions or signs of delirium. Thought process was oriented with no signs of flight of ideas or loosening associations. His perceptual disturbance had no signs of visual or auditory hallucinations. His cognition, he was a little bit sedated because he just recently received the Benadryl before his transplant, but he was oriented times four. His insight was poor, given that he refused to talk to us at all, and his judgment was also poor, given he didn't want to talk to us. For his diagnosis, Axis 1 was generalized anxiety disorder, Axis 2 was deferred, Axis 3, he has acute lymphoblastic leukemia, asthma, and eustachian tube dysfunction. Axis 4, he's chronically medically ill and he has recurrent hospitalizations. And Axis 5 is 65. So the plan for this kiddo, we decided to start him on Rimron, because this medication is really good with helping to treat insomnia and also depression. So Rimron, 7.5 milligrams at night, and then also hydroxyzine, 12.5 milligrams PRN TID for panic attacks. So how Rimron works, it's an antidepressant. It's also known as mirtazapine, and this medication works by boosting neurotransmitter serotonin and norepinephrine by blocking alpha-2 presynaptic receptors on serotonin and adrenergic neurons. And this is a very unique medication. It has a novel mechanism independent of norepinephrine and serotonin reuptake. It also blocks H1 histamine receptors, and some common side effects include sedation, weight gain, and dry mouth. And hydroxyzine, also known as Atarax, is a histamine receptor antagonist, and it works by blocking histamine 1 receptors. Common side effects for this medication include sedation, tremors, and dry mouth. So we decided to start those medications on this kiddo, and we will continue to closely monitor his response to these meds. And let me know if you have any questions. All right, bye.